The magic pill. It's often talked about, and I think that we have to clarify today this discrepancy between what researchers or drug companies think is a magic pill and what normal people think is a magic pill. So let's take, for example, diabetes medications, oral medications. If you look at the studies, the arms where people take the medicine and the placebo control group where people don't take the medicine are different, but they both have something in common. The people who don't take the medicine don't do nothing. The people who take the medicine do the same as the people who don't take the medicine. They take exercise, they get counseling, they get education on healthy eating habits. The whole point of the pill for diabetes is that you don't have to change your lifestyle. You don't have to worry about all these little things. That's what most people think when they think of magic pills, right? You don't have to put effort into things, because that's sort of cheating. It's like the story of stone soup. We all know the stone is not magic, like the villagers thought. It's because they put all the stuff in that it tastes good. The stone has really nothing to do with anything. And that's the thing with effort. The people who need these medications are the ones who do not, or cannot, or will not put in the effort. And herein lies the issue. It's not magic if you have to do stuff. Magic is when you don't have to do stuff, right? Most people wouldn't believe it when somebody advertises this magic thing for building up your body. Become a muscle man. Just take it, and tomorrow you'll wake up after having doing nothing other than sleeping and eating, muscular. Yeah, you have to take creatine and you have to work out. Anabolic steroids don't work if you actually don't physically do anything. I mean, those of us in the medical field understand that, but I think the public may not. And I think that's the issue with the magic pill. Let me tell you what the criteria for magic pills are from a public's perspective. It has to be easy to do. I'm not talking about 4 times a day pills. I'm talking about pills that have side effects like diarrhea. I'm talking about something that's easy, that I could take, doesn't affect my lifestyle, and I go on with my day, right? Certain things are wonderful drugs like levothyroxine, thyroid replacement. A lot of people need it. Makes them feel better. But guess what? To be well absorbed, you have to take it on an empty stomach. That means not anything close to food. Do you understand how hard that is for people? So if you think about it, right? There's this medicine. It's a prescription, so it's a medicine. That is almost magical. It's called high ppm fluoride. Very intense fluoride therapy. You just brush it on your teeth like you do normally. It may actually heal the protective coating of your tooth. I discovered it, I used it, and my teeth felt better. I think it healed my teeth. I don't have the same teeth issues. So I excitedly told my brothers, who've had tooth issues ever since their teens, root canals by the time they're 20, basically. One already had it. He just doesn't use it. He's like, do you know how hard it is? You can't, rinse your mouth, eat, drink for 30 minutes afterwards. I mean, how hard is that? But I guess for him, that's a big change in his lifestyle. So it has to be easy to do. And the last thing, but very important, that maybe drug companies don't get, it has to be effective right away. See, we normal people, we patients, don't like to see effect months, years down the road. We like to see effect right away. We're not expecting to be a game changer in the sense of heals our cancer in a day. But we would like to see it take effect sort of pretty quickly. And the full effect may take weeks or months, but that's fine. We just want to see it being effective right away, to know that it's making a difference. And I think that's sort of it for the magic pill. Now, where is it? I read an article about drug companies having to design chemotherapy agents, rather cancer agents, because chemotherapy is a generic term, that are less toxic, that are more tolerable, because we've gotten so good at curing cancer. Sort of. They talked about more for breast cancer, which we are pretty good at, but a lot of cancers we're horrible at. But the whole idea is, in the past, the trade-off between cancer, death, and living was big enough that people were willing to take all the toxic effects of chemotherapy. But not anymore. Right? Is it just a wholesale shift in the public perception? I don't know. I remember asking people this question. Remember when that movie came out, 172 hours or whatever, 144 hours, about the guy who was an avid outdoorsman and his arm got caught underneath a big boulder when he's hiking one day, and he had to cut off his arm to escape and to basically live. How many people have the strength of mind to do it? And then the people who haven't watched it, you tell them the details. Oh, no. Not just about cutting off your arm. See, he has a little Swiss Army knife. It's not strong enough to cut through the bone. He had to figure out a way to break the bone so then he could cut it off. And they're like, ooh, right? I mean, you know how many people drowning or this or that or stuck at sea and they just sort of give up. I don't know what they actually do when time comes to it. If they're put in that position. But most people just give up so easily. And maybe that's just society. We're more into easy stuff, easy solutions. And when it's hard, we think it's often not worth it. And that's why this discussion about magic pills is so important. Because I feel many people in the medical field don't understand what's like from the other side. I mean, this thing called H. pylori, it's hard to take the treatment, but why? It's just a few drugs for a few weeks, right? H. pylori could cause gastric cancer. That could kill you. But many people don't finish it. My wife's cousin's wife died young in her 30s from stomach cancer. They didn't catch it. By the time they did, she basically was dead. She lived 1 month afterwards. She had taken the H. pylori treatment, just never completed it. Did she know she would die? I don't know. Or is it just, even if she knew, it's just so low risk, so far ahead in the future? Don't think about it. I think that's why it's important to think about what a magic pill is, what patients think a magic pill is, and what we do with the knowledge of what they think a magic pill is.